we have to take precautions, and we have to make sure we get the right information out there. And I want to say I commend my Department of Health, Dr. Whalen, for everything that they're doing, because we're staying ahead of it. And I also want to commend the Governor Cuomo and the Department of Health and Homeland Security. I've had more briefings in this last short couple months than I have ever from the state of New York in the last 8 years in office, because of the seriousness of this. But we also don't want people to panic, and we want to put out the right information. That's why we waited to have the press conference, and Dr. Whalen's going to get into all the different stuff. And it's important. Myself being a former first responder, it's important the first responders, from EMTs to paramedics to the fire departments to the police departments, to people that generally respond, to the hospitals, to the schools. I mean, there's tons and tons of questions that have gone on over this, and the misinformation, buying masks. Oh, if you buy this mask, then you're fine. They don't work. And Dr. Whalen will get into all that stuff. But I also want to remind people, we are still in the flu season, and this is the worst strain of flu that we've seen in years, too. So not to overstep the seriousness of the coronavirus, but to also look at what's going on with the flu epidemic on top of it. But unfortunately, we just got confirmed, it appears there are now 6 confirmed cases of the coronavirus in New York State. It just changed this morning. Last night it was 3. This morning I wake up, it's 3 more. These are things that you're going to see more and more of. And if you look around this great nation and you look around the world, I mean, Milan in Italy shut down. People, cities are shut, churches are closed, schools are closed, businesses are closed. I'm hoping that we're not going to get there, but we don't need to panic either. And this is a serious topic that we have to address, that hopefully it doesn't get bad like it has, over in Europe. But if it does, we need to continue to address it. And, I know a lot of people want to, had questions about the Canadian border, had questions about students on visas coming from foreign countries that fly into New York City, then continue the way up here, or people going on vacation, because I had my niece say, hey, I'm going to Italy at the end of March. And I said, you are? And she said, yeah, any restrictions when I fly back? And I go, you might want to check, because Milan shut down. So I don't think I would fly there right now. But these are things. And if you look at the 10 top places not to go right now, even the United States is on that. We just got to be cautious. But we have to put out the right information, and we don't want to panic people. That's why we really have been working hand in hand with the governor's office and with Homeland Security and the health department and our health department. And Doctor, I cannot thank you enough for your leadership on this, for the role of your people in there. I know you've been going around the clock with everything going on, and the updates you've been getting. I feel like I'm in the war briefing room on all the phone conversations we've been on and listening to, and really the state's taking a really good lead role in this. So we're here to knock out some of the rumors and put out some of the precautions out there that you can take, especially for our first responders, and how we're going to address this going forward. We've had a few people that we had to put in observation. They willingly went in there, and thank goodness, nothing, But we are a capital region with some of the best education universities, I feel, in the United States, that we have a lot of foreign students. We have a lot of people that travel. And again, we're 3 hours from the border. People can cross the border, and these are questions we're going to have to address and how it goes on. So I will take questions at the end, but it's more important to hear from Dr. Whalen on this, on the coronavirus, and how we're going to address it going forward in some of the other issues. So Dr. Whalen.
It is a really critical time for us to be able to get information out to the public. So this is a great opportunity for us, and we look forward to giving you information. Now, having said that, I have to give an immediate caveat. This is a rapidly evolving situation. So some of the slides that I'm going to show you are already out of date. We are getting information from the state and federal health departments, that's federal is the CDC, on a daily basis, sometimes on an hourly basis. So guidance is evolving. We are adapting. We are in very close communication with multiple community partners on this, and I'll talk about that a little bit when we get into local preparedness efforts. What I'd like to do to start off with is So forward is, yeah, you told me right, it's not. By pointing it the wrong way? There we go, got it. Okay, so I'd like to provide a little bit of information on COVID-19, which is the novel coronavirus, to talk about the current situation, and this will be globally and in the state and locally, talk a little bit about our local state and planning going forward. So many of you are aware that one of the biggest challenges that we are facing is keeping up to date on information. As I said, we are really looking at information from all sources on a continuous basis. COVID-19 is a novel coronavirus. What this means is that it is a virus that has not previously been seen in humans. So that means there is a general susceptibility to this. Because this virus has not been seen in humans before, we are learning about how it behaves, how it affects people, how it is spread, and that information is evolving on a rapid basis. The information that we have currently is out of China, but as you know, we are getting more information on a daily basis. It is predominantly a respiratory infection. So unfortunately, as the county executive stated, we are currently in New York State still in very active flu season. We have widespread cases of flu. It behaves an awful lot like influenza. And one message I would get across is that the vast majority of people in Albany County that are currently experiencing febrile respiratory illnesses, the likelihood at this point is that this is influenza or another viral pathogen, but this could change. It is spread by droplet, which is cough and contamination of surfaces. All of you and everyone in the public should be aware of how these infections are spread because it helps influence the behavior going forward of how we can prevent this from spread in the community. People cough, they cough and droplets are released. The droplets can either be inhaled by another person who's in close proximity, or they can rest for a short period of time on a surface. People touch surfaces and then touch their faces. So this is really important to know that this behavior influences how we teach children in particular, but everybody, about hand hygiene, the necessity to wash your hands, the necessity to use products related to hand hygiene, trying not to touch your face, and coughing into your elbow, and staying home if you're sick. We know that this is a contagious virus. Something that's been said a lot in the press is this R0 value. What does that mean? An R0 value is a scientific or epidemiologic value that talks about how contagious a disease is. So it means for every person that gets it, the likelihood is that the R0 value will contract it for them. So with coronavirus, what we are learning is that the R0 is 2. So for every person that gets coronavirus, the likelihood is that 2 will get it from them. This is slightly higher than influenza. We know, based on data from China, that 80% of people that contract this disease have a viral illness that resembles the flu, and it's somewhat mild. So people get a fever, they get a cough, they can be managed at home. In about 15 to 20%, which is what we're seeing, is people with comorbid illness, such as respiratory or cardiac problems. They can go on to develop a more severe strain, which requires hospitalization and occasionally will require interventions such as respiratory support. The mortality rate, we're learning a little bit about this. Again, the data is evolving, so we cannot give a precise figure, but it is thought to be between 1% and 3%. So this is a map of all the countries in the world that are currently affected by coronavirus. We know to date there have been about approximately 90,000 individuals infected with this, and there have been about 3,000 deaths. So we are keeping an eye on that, and as you see, and if you look, there are tools available online so you can see how this is tracked since the beginning of the year. It is something that is rapidly expanding across the globe. This, we are told, means there is a potential for pandemic, although the World Health Organization has not classified it as such yet. But we are still seeing these levels really lets us know that we have to start to consider preparedness efforts. This is a current situation of states that are affected in the United States. And as you see, New York State is one of the states where we have diagnosed cases of coronavirus. And I'll talk a little bit more about that in terms of this data. Again, PowerPoint was put together last night, already out of date. Total number of cases as of yesterday was 60. 22 of these were travel related, 11 were person-to-person spread, and 27 were under investigation, which means that epidemiologists are trying to do contact tracing and determine how someone contracted the disease. In New York, again, this slide is already out of date. As of yesterday, we had 41 people under investigation, and there was 1 positive case as of yesterday morning, 2 as of yesterday afternoon, and I'm learning walking in here that now we were up to a total of 6 due to the situation in Westchester County. We are starting to see evidence of community transmission in the United States, and we have particularly seen this on the West Coast in Washington State. We are also hearing about first fatalities. Unfortunately, the situation in Washington State was this virus hit an incredibly vulnerable group of individuals, and this resulted in mortality of 9 people. In Albany County, we have not had positive cases. We have currently tested 1, which was negative, and we have another test that's currently pending, an individual with a travel history, and I'll talk a little bit about the containment measures that we're undertaking. In terms of planning for coronavirus, the structure of planning is incredibly important, and I want to talk about the phases of preparedness for coronavirus. The first phase, and the phase that we are currently in the midst of, is containment. What does containment mean? Containment means that to date, we have not had cases in Albany County. We are now looking at strategies to keep cases out of Albany County. This includes things like looking at isolation and quarantine of individuals who are coming back from high-risk areas, and I'll talk a little bit more about that. The next phase is community mitigation, and that is when we start to see cases present in the county, we may consider the closures that people are concerned about, whether it's individuals' closure of schools or businesses, or large-scale closures, which would include banning mass public events. We're not there yet, but it's important that we realize that this is a situation that we may be facing in the future, and I want you to know we're actively planning with partners for that. So, containment strategies, as I talked about, these involve movement and monitoring strategies, and this is where the local health departments across the entire country have been busy day and night since the beginning of February. These include things like travel restrictions, airport entry screening, movement restrictions, and monitoring of people at high and medium risk, isolation and quarantine. I want to make sure everybody's aware of what the difference is between isolation and quarantine. Quarantine refers to putting people in a controlled environment before they develop symptoms. So this is taking asymptomatic individuals that we think were at risk of being exposed to a disease and putting them in a location where they cannot spread the disease for the incubation period of the disease. So with coronavirus, we know that the outside incubation period is 2 weeks. So if we are quarantining, as we have done, individuals coming back from high-risk areas, that means that we're ensuring that they're in an appropriate location, do not go out, do not go home, outside of their home to school or work for a period of 2 weeks. And we are actively monitoring them on a daily basis. Isolation, on the other hand, refers to a similar containment of individuals who we now know have the disease and have symptoms. So not everyone that contracts coronavirus will require hospitalization. So it's important that we start to consider how these people can be managed at home so that they have the least opportunity to transmit this disease to others. That is how we talk about isolation. We have also been coordinating with the state on all testing. All current testing for coronavirus in New York State goes through the local health department. As I said, this is guidance as of today. It may change. I know that there has been information in the national press that sounds a little bit different to this, but as of today, everything goes through the local health departments. So the goal of these containment strategies, as I said, is to rapidly identify new cases and to limit secondary transmission to persons who are under isolation, so exposures are limited and transmission chains are suspended. So currently, the CDC has travel restrictions to avoid all non-essential travel to China, Iran, South Korea, and Italy. These are the level 3 countries. And as County Executive McCoy indicated, those that you know that are considering traveling to Italy, they shouldn't be going at this point. It's likely that anything that they're going there to see will be closed down. It's likely that they could have significant disruptions in travel, so we would recommend that non-essential travel to these regions should cease immediately. We know that the federal government has extended entry restrictions, prohibitions of foreign nationals if there's recent travel in China and Iran. We are being asked to consider postponing travel to Japan and practice usual precautions in Hong Kong. I will tell everybody that again, as this is a rapidly evolving situation, the best place to get information on up-to-date travel recommendations is on the CDC website. The next thing I want to talk about is community mitigation. So we talked about the containment strategy. Now let's talk about what happens when we start to see cases, if we start to see them in a local area. This graph, and I know it's a little bit dry to put a graph up, but I think it's important to look at the trajectory. So this big purple curve here looks like what would happen if we didn't do anything. If coronavirus came into the county and it played out its course. We would get a high number of people that are ill. It would happen very quickly. We would likely have significant concerns with surge capacity for first responders, for law enforcement, for hospitals, for care providers, and it's a very difficult to manage situation, and a lot more people are getting ill. With these mitigation strategies, we are looking at changing that curve to this bottom curve. So these strategies are designed to make sure that less people get ill, that we do as much as we can within the community to prevent people from getting ill, and to give us a little bit longer time trajectory so that we can utilize resources that we have appropriately and use the time needed to plan. So that's exactly what this is supposed to do, delay exponential growth, provide more time, and decrease the height of the peak. And obviously the biggest thing is to reduce the total number of cases. So there's 3 categories of what are called non-pharmaceutical interventions or the community mitigation strategies. These include personal. These are measures for everyday use. And if everybody here leaves home with a take-home message, it's know what this means. This is hand hygiene. This is respiratory hygiene. These are the points about making sure you wash your hands frequently, utilizing hand hygiene products. If you are touching surfaces frequently, if you use a computer that others are using to wipe down surfaces, to cough into your elbow if you are coughing, and to stay at home if you're sick. Community NPIs include alteration of business practice, school closures, social distancing, and cancellation of mass gatherings. So this is a next phase that we're not there yet, but we need to consider how we are planning for this. And also, as I pointed out, environmental NPIs, like surface cleaning measures. There have been a wealth of guidances on these, also issued by the CDC over the weekend. And in particular, if people are interested in knowing about what are the good cleaning products to utilize for businesses and for schools, there's references on the CDC website. So the bottom point here is the question mark. What are the triggers for us to switch from containment to community mitigation? And the answer is that this is less likely to be a switch that we throw and more likely to be a dial. We are going to be working very closely with our state and federal partners. It is not likely that Albany County will be the first county in the United States to implement measures like this. We're seeing measures like this already taking place in the western United States. But we will be working very closely and actually are already working on those plans with community partners. So I want to talk a little bit about what we have done to date at Albany County Department of Health to prepare for this. As I stated, we have been tasked with the responsibility of tracking and monitoring individuals coming back from high-risk countries, from the level 3 countries. At first, we were getting reports from the Border Patrol to the CDC, to the State Health Department, and we would get lists of people that were coming in from China. And then we would contact them and make sure that we were issuing appropriate guidance, that they would stay in a location where they had their own bedroom, where they had their own bathroom, where they had their other needs taken care of. We would check in with them on a daily basis to ensure that they didn't have fever or symptoms. And the knowledge was that if they developed any concerns, that we would facilitate any healthcare needs that they would have. To date, we have tracked 37 individuals in 27 households. As of today, we are tracking 11 individuals in 7 households. To date, we have had 1 individual that has had symptoms that required testing, and this testing was negative. As I said, we have been implementing this daily monitoring where our nursing staff are contacting these individuals on a daily basis to ensure that appropriate control is taken. We've had coordination of all testing. So if there is any testing that needs to be done, it is done through the local health department. It's important to know that if people are concerned about symptoms, if they're concerned about testing, the New York State Department of Health has set up a hotline for questions on testing. That should be the first line. The second line is to contact the local health department in conjunction with your provider, provided this is not a need for emergent care. And we work with the hospitals and other care providers to facilitate that testing. As I said, the hospitals at this point are very busy dealing with influenza. So it is important that people be aware that hospitals are for people that acutely need hospitals. And we want to really try to get the message out to the public that people with mild symptoms should contact the state or county Department of Health or their provider, and then we can take it from there. We've had very frequent briefings with the CDC and the New York State Department of Health. I want to say that these have been almost daily, and the guidance is being updated very frequently. When we get guidance, we share this guidance with our community partners. This includes our hospital partners, it includes our provider community, it includes EMS, it includes law enforcement. We have been working with all of these providers to get this information across. We have had, I want to talk next about the planning meetings. Within the last week, we have had meetings with all of the universities. We have had meetings with regional EMS. We have had meetings with law enforcement. We have had meetings with hospitals, and we have been in constant contact with our providers. These meetings have discussed difficult issues like surge capacity, like supplies, and we are coordinating with our partners concerns that these agencies have. We have also been taking calls, media response, and we have updates on our website. The County Health Department website does have information on coronavirus, and we encourage those who want to learn more to look through the County Health Department's website, as well as the New York State Department of Health website, as well as the CDC. And we are also tasked, although it has not occurred yet, with epidemiologic investigation of cases. So should there be a case in Albany County, our epidemiology team, and headed by Liz Lewis, our epidemiologist, will find out who that person has been in contact with, do contact tracing, and implement appropriate control measures. And that's a very active process and one we do for many communicable diseases. So as I said, we are, there's two documents that I want to reference and talk a little bit about that I think are important for the public to be aware of now. Because as we consider that we may enter into the community mitigation stage of things, it's important for our local citizens and businesses to be aware of what they need to start thinking about. And there's very helpful guidance documents which are linked here on the CDC website. The first is for household preparation. Get your household ready for COVID-19. And the second is for business preparation. What do these talk about? Household readiness, how to practice preventive actions now. And this again, I know we continue to say this again and again, but it is the single most important thing we can do to stem infectious disease is to teach people about appropriate hand hygiene and respiratory etiquette. These strategies are much more helpful to individuals than going out and purchasing masks, which is not recommended. Our hospitals need to have masks. For the general public, it is not going to assist you. If you are sick and you're going to a provider's office, let them know and they may provide you with a mask when you get there. But to wear masks in the general public is not at this point recommended and is an inappropriate use of resources. People should start to consider, do they have a room in their home that can be used to separate sick household members from those that are healthy? Again, if you have someone in your home who has a mild case of this disease, you want to prevent others from contracting this. So there is very specific guidance on how to care for someone in the home with COVID-19. Obviously, if someone is severely ill, they would need hospital care. But as you know, with regular influenza, most of these cases can be managed at home with fluids and supportive measures like Tylenol, Motrin, et cetera. People should be prepared for things like child school closure or child care suspensions. These are things that could be on the horizon, and it's important to develop a contingency plan. Plan for potential changes at your workplace. Plan ways to care for those who might be at a greater risk for serious complications. And identify aid organizations and make those important connections with your neighbors, particularly if you have elderly neighbors that may be in need in your community so that you can assist others and assist yourself. For business preparation, it's very important that employers consider how important it is to have sick employees stay at home. Sick employees need to stay at home. This is something we encourage through flu season. A lot of people do have the mentality, I'm going to tough it out and I'm going to go to work and I'm just going to get through it. We need to abandon that mentality, not just with COVID-19, but in general. It does lead to increased communicability of all infectious diseases, particularly respiratory diseases in flu season. Again, emphasize respiratory hygiene. Start to teach your employers. If you have an HR department or a health-related entity within your organization, make sure they're getting this information out to your employers. We had a department heads meeting here at the county and started to introduce these discussions with our county staff. Advise employees before traveling to take steps. People should be looking actively at the CDC website and be aware of any concerns that they may face traveling to affected areas. Of course, this is categorical for level 3, but in other areas, they may consider that they may have likely disruption as this is a rapidly evolving situation. Explore whether you can establish flexible work site, flexible hours, identify your essential function and staff, and establish communication with employees. So these are some important guidelines that I think is necessary for people to start to look at this point. We are not too early in this to start planning for this potential eventuality. And the more we can get that information to the public, the better that we will be prepared if we need to be prepared. I think this is common sense, and I think that this knowledge is certainly not about spreading panic. At this point, we know that the risk for Albany County residents remains very low, But we want to have a common sense approach to this so that people are aware of how they can protect themselves, protect their families, and protect their businesses. So please utilize these resources and push them out to the degree possible in the press. There is a lot of additional guidance that is coming through both the New York State Department of Health and the CDC. This weekend, there was a plethora of guidance that was issued, including childcare, schools, colleges, university, healthcare professionals, first responders, law enforcement, community events. We're pushing these guidance documents out as quickly as we can get them, but we need assistance. So for those of you that are in positions where you have a large email distribution list that you would like to spread this to, we are happy to provide you with those links, or you can find them yourself on the CDC website. I think it's important at this stage that we're all on the same page, because this is going to be a community effort to stem this in our community. So I appreciate all of your input going forward.